Today we are very thankful to all the media persons, to media houses, both the print and electronic media that you are here to come to hear our side of the story. Every story has two sides. Therefore, today we would like to share to you our side of the story. We are very deeply anguished and distressed to inform about yesterday's incident wherein two of our sincere health professionals were physically assaulted by the patient attendant. We were very much aware that such negative sentiments were brewing in the public, in the various social media, various social forums, but we do not anticipate such kind of assault on the frontline healthcare workers. Therefore, we have invited today all of you to share our side of the story. Yesterday, for no reason, no fault of theirs, one senior resident and one junior resident from the Department of Pediatrics were assaulted. One sustained a grievous injury. And let me reiterate for a fact, one of the junior resident who was assaulted was a non-localite. He had come to do his residency, that is DNB residency in pediatrics, all the way from Telangana. So it was very, very sad and gave us a deep anguish and demoralized all the working staff, including the doctors, nurses, and all other allied health professional workers in the hospital. Now, regarding yesterday, some of the media houses, आप लोग ने बताया है कि आप लोग गुस्से में हैं, आप लोग हम लोग का ट्रिम्स अथॉरिटी और फैकल्टी से कि आपने हम लोग कल why we did not allow you yesterday to basically highlight the incident at TRIHMS. Let me reiterate, we are very appreciative of your effort. In fact, the very fact that we have called you is to seek your help. You being the fourth pillar of democracy, we need your support, we need your guidance. A lot of negativity has come into the social media, and we are not even sure how it started, because we were thinking we are doing good things for our state. Therefore, we request and ask your help in bridging that trust deficit that has happened. Like I said, it may be because हम लोग का गलती से भी हो सकता है. It may be because of some bad elements in the society जो social media में रह के हम लोग का negative effect हुआ है. But from the social media हम लोग को ये तो पता चलता है कि a huge trust deficit has occurred between the public and between the healthcare workers at TRIHMS. And therefore, it is very pertinent, I reiterate again and again, we all at TRIHMS administration request your support in bridging that gap, so that the people of Arunachal Pradesh, the poor, sick, needy people of Arunachal Pradesh start to have faith in the medical system, start to have faith in the healthcare delivery services that is prevailing at TRIHMS. So Firaj, जैसे कि I want to tell you again, कल का तो we are very, very sorry that we could not allow you yesterday for two main reasons. एक तो ये था कि we were actually literally scared. दो अटैक हुआ है तो हम लोग ने सोचा है कि और भी अटैक आ सकता है, तो we wanted to stay together. एक जगह में हम लोग बैठ के प्रोटेक्ट, एक दूसरा को प्रोटेक्ट करने के लिए. और हम लोग, आप लोग तो कोई तो बोलेंगे कि हम प्रेस वाले हैं, लेकिन हम लोग को तो पता भी नहीं होता कौन प्रेस वाले हैं. कभी कभी इट्स वेरी वेरी डिफिकल्ट इन सच अ टेंस सिचुएशन टू फाइंड आउट और टू नो कि कौन प्रेस वाले हैं, कौन नॉन प्रेस वाले हैं. एंड दैट वाज अ रीजन टू प्रोटेक्ट आवरसेल्व्स from the further physical assault by the public or by so-called the patient जो हम लोग से गुस्से है. इसलिए we had to refrain the press and the media to come inside the hospital campus, and we are very sorry for that. And number two, Our doctors, especially the junior doctors who are the frontline workers, were very agitated, understandably so. They were very emotional. तो therefore हम लोग सोचा है कि अगर आप लोग आएंगे तो हमारे कोई डॉक्टर शायद कोई इनअप्रोप्रिएट स्टेटमेंट दे देंगे, कोई इनअप्रोप्रिएट बात बोलेंगे आप लोग को, that would further tarnish the image of the institute, जो already like I said trust deficit already बन चुका है. So therefore we did not want that situation to flare up and further tarnish the image of TRIHMS. इसी दो reasons का वजह से we did not ask you, or rather allow you to come inside and cover the incident that happened, the unfortunate incident that happened yesterday. Before I complete the press statement, once again I would like all of you to know the very fact that we need your support. इतना negative sentiment हो चुका है public पे. It is your responsibility, my responsibility, our responsibility. It's a collective responsibility of everyone to bridge that trust deficit. ऐसा माहौल क्रिएट करना चाहिए. आप लोग भी थोड़ा रिस्पॉन्सिबल होना पड़ेगा. You are very responsible. I'm not saying anything, but increase your responsibility to remove the negative sentiment, negative feedback that has crept into the minds of the public. And we assure you as TRIHMS faculty, as TRIHMS administration, we are doing our level best to the best of our capacity, skill and knowledge to provide the kind of services that is appropriate, the kind of services that is expected of us. And we will continue to do so despite all the trouble, despite all the negative sentiments that we have, that is already brewing up in the public forum. Yes, very pertinent question. We do have, in fact, like you said, after there was a Supreme Court order as well regarding the very same. But yes, coming to our local incident that happened in SEPA, we had in fact reviewed the security situation. We have, in fact, after that very incident, we have set up the police outpost, which is, you may have seen, just outside the emergency and the trauma department. And at the same time, we also have security personnel. We have outsourced the security to one outside agency, and we have about 70 security personnel, private security personnel. But I say 70 is very, very less for providing security within the hospital and within the premises of TRIHMS, because 70 सुनने में बड़ा है 70, but 70 तो they cannot be employed all the time. They have to be in shift. At the maximum that we can do is 3 shifts. तो just imagine करो कि आप गेट भी हमारे पास थोड़ा 4-5 है, हर गेट में डालने से हो जाता है. वार्ड हमारे पास इतना ज़्यादा वार्ड है, ओपीडीज है, ओटीज है, आईसीयूज है, एसएनसीयू है, आईसीसीयू है, एकेडमिक ब्लॉक, ये तो हॉस्पिटल का स्ट्रीम है. We have the academic block, director's office, we have the lecture halls. So basically, yes, we have already asked and placed in front of the government of Arunachal Pradesh to provide us more security personnel. Yes, the file is on the way, and we will intimate to you when, and we have on priority basis, we have asked the government to give us another 80. So totally we have at least 150 security personnel.